How are we confirming that we are in the subarachnoid space during spinal anesthesia? As we are practicing spinal anesthesia in day-to-day of our life, day-to-day of our practice, but how are we confirming it? We can confirm that after introduction of the spinal needle, the fluid that comes back through the spinal needle is CSF or not, immediately at the bedside by the two procedures that are temperature of the fluid and the oily appearance of the CSF. As we know that the CSF has the normal body temperature, so we can confirm that the fluid coming back from the spinal needle by its temperature. And another one is the oily appearance of the CSF. We can do some lab investigation such as glucose, protein and pH of the CSF, but it's a time consuming. These two methods shown in this picture are the bedside test. So this is the oily appearance of the CSF. As we pull back the plunger of the syringes, there is a oily appearance that we seen when the needle is in the subarachnoid space and the fluid that comes back from it is a CSF. But what is this? Why we are seeing this? What is the physical phenomena of this? The effect that is shown in that figure is known as Schileren effect. So what is Schileren effect? It's a physical phenomenon based on the varying refractive indices of a transparent medium. Before explaining this phenomena, we should know two things, that is what is density and what is bericity. A density is defined as a weight in grams of 1 ml of solution. So the average density of CSF is around 1.00059 gram per ml. And the bericity is defined as it's a ratio of density of local anesthetic solution to the density of the CSF. So a solution is said to be hyperbaric if its density is less than that of CSF density, and hyperbaric if its density is more than that of CSF density. As we know that the bupivacaine we are using for spinal anesthesia is a hyperbaric. So why hyperbaric? As the term itself means, it's more denser than that of the CSF, meaning that its density is more than that of the CSF density. We are using a 0.5% bupivacaine, which contains 5 mg per ml of bupivacaine plus 80 mg per ml of glucose. The total contents of this ampule is 4 ml, so it contains of 5 into 4 is 20 mg of bupivacaine and 8 into 4 320 mg of glucose, so making it more denser than that of the CSF, corresponding its density to around 1.02890. So the why this Schileren effects happens, as described earlier, it's a physical phenomena of refractive if the refractive indices of a two transparent medium is different. And we know that the happy bupivacaine has a higher density than that of the CSF. So when CSF enters into this transparent medium of the happy bupivacaine, there will be the refraction of a light occurs, and that is seen as a shiny appearance of the fluid. So in this way, we confirm that the fluid that is coming out of the spinal needle after introduction of it is CSF. That is called a Schileren effect. And sometimes we may be confused during the epidural spaces. We push some NS in that spaces. We use NS fluid for confirming the epidural spaces. So this normal saline also has different density than that of the happy bupivacaine. So we are confused that the fluid that comes out from the catheter is a CSF fluid or it's a normal saline that we pushed out. So we can confirm it by if this Schileren effect lies centrally and it comes back along with the plunger. When we pull back the plunger, then it's the effect of the CSF. But if it's a normal saline, then this effect will be remain in the anterior and uppermost part of the syringe. It will not come back and it will not lie centrally as shown in the figure on the left side. So this is the main phenomena we are seeing during day-to-day life of our practice, that is called Schileren effects. Thank you all.